Welcome to the Pathways to Wellbeing documentation course, Eligibility for Pathways to Wellbeing and Enhanced Services form. This course is one in a series of learning opportunities designed to help familiarize you with pathways to well-being and continuum of care reform concepts, practice, and documentation. Pathways to Wellbeing supports youth by bringing together the child or youth and their family, behavioral health services, child welfare services, and other critical partners to support the safety, permanency, and well-being of youth involved with the child welfare system. As a behavioral health service provider in the County of San Diego, your responsibilities under Pathways to Wellbeing include creating and maintaining complete and accurate documentation of service activities. This course will describe the Eligibility for Pathways to Wellbeing and Enhanced Services form and how and when to access and complete the form to ensure the youth you serve receive the appropriate Pathways to Wellbeing designation. This short course is designed to familiarize you with the Eligibility for Pathways to Wellbeing and Enhanced Services form. You will learn what it is, when to complete it, how to access the form, how to complete it, and some helpful tips to support you along the way. The Eligibility for Pathways to Wellbeing and Enhanced Services form is used to determine if a youth is eligible for Enhanced Services subclass or eligible for Pathways to Wellbeing class. If a youth is determined to be eligible for Enhanced Services subclass, the provider is required to comply with state-mandated pathways to well-being processes and timelines, including the provision of intensive care coordination, or ICC services, convening of a child and family team, documentation standards, and compliance with child and family team meeting timelines. Youth that are not determined to be eligible for Enhanced Services subclass and or eligible for Pathways class are still eligible to receive intensive care coordination services, including child and family team meetings, but providers are not required to comply with state-mandated Pathways to Wellbeing processes and timelines. Providers will complete the Eligibility for Pathways to Wellbeing and Enhanced Services form for all youth that have an open child welfare services case, including voluntary cases. This form must be completed within 30 days of intake, after reassessment, and at discharge. Intake refers to the first 30 days in which a youth is open to a BHS program. Reassessment refers to any noted changes throughout the course of treatment that would impact a youth's Pathways to Wellbeing status while open to a BHS program. Discharge refers to when a youth is no longer receiving services from a BHS program. The completion of the Eligibility for Pathways to Wellbeing and Enhanced Services form should always guide the process of determination of the Pathways to Wellbeing status. Once determined, the status will be entered into the Client Categories Maintenance, or CCM tab, in Ccbh Electronic Health Record. Please refer to the Entering Pathways to Wellbeing Eligibility in Cerner Community Behavioral Health Client Categories Maintenance Documentation Microlearning for further information. Providers should complete the Eligibility for Pathways to Wellbeing and Enhanced Services form in conjunction with completion of the Pathways to Wellbeing section of the Behavioral Health Assessment. Please refer to the Pathways to Wellbeing section of the Behavioral Health Assessment Documentation Microlearning for further information. The Eligibility for Pathways to Wellbeing and Enhanced Services form is completed in Ccbh. To access the form in Ccbh, log on to Ccbh. Select your client. Once the Adding Assessment box pops up, select the plus sign above New Assessment. Select Assessment Type. Select Eligibility for Pathways Path and enter the date you are determining eligibility. When completing this form, first check the appropriate box for the current time period for completion of the form: intake, reassessment, or discharge. Next, fill in your program name. Section A determines eligibility status. The youth will meet criteria for Enhanced Services subclass if the answers to questions 1, 2, and 3 are yes, and the answer to either question 4 or 5 are yes. Question 1. Indicate whether the youth has an open CWS case. Question 2. Indicate whether the youth meets criteria for medical necessity. Medical necessity is met if the youth has a Title IX included diagnosis, has a significant impairment in an area of life functioning, and mental health services are likely to result in a positive impact. Question 3. Indicate whether the youth has full scope Medi-Cal. In instances when a child or youth does not have full scope Medi-Cal, they would be determined as class or eligible for pathways to well-being. Question 4. Indicate whether the youth has had 2 or more living placement changes due to behavioral health needs over the last 24 months. Collaboration with the Child Welfare Services Protective Services Worker, or PSW, will assist you in answering this question correctly. Please note that juvenile hall, psychiatric hospitalization, and/or Polinsky Children's Center are not considered placements for the purposes of completing this section. Question 5. Indicate whether the youth is currently being considered for, receiving, or has recently been discharged from any of the following types of services, generally within the past 90 days. Crisis stabilization, for example, the ESU or the North County Crisis Intervention and Response Team. Psychiatric hospitalization. Placement in an RCL-10 or above, or short-term residential treatment program, or STRTP. Special care rate, or SCR, due to behavioral health needs. Therapeutic behavioral services, or TBS. Wraparound and/or comprehensive assessment and stabilization services, or CAS. Foster Family Agency Stabilization and Treatment, or FAST, or Intensive Services Foster Care. In Section B, indicate the child or youth's eligibility. If the youth is eligible for Enhanced Services subclass, check this box. If the youth is eligible for Pathways to Wellbeing class, check this box. If the youth is active to subclass or class, check this box and include the date that the youth became active. If the youth is inactive to subclass or class, check this box and include the date that the youth became inactive. Dates entered here must match the current eligibility determination date. In Section C, include the current CWS Protective Services Worker's name and phone number. Check the corresponding box detailing whether this is an out-of-county CWS case. Provide the BHS clinician or provider's name. The BHS clinician should always list themselves as the care coordinator on this part of the form. When you're filling this form out, ensure you select Yes for this section. Once you have completed all sections of the form, sign and print your name and include your Ccbh ID and the date. It is important to complete all sections of this form accurately, and collaboration with Child Welfare Services is necessary to ensure the appropriate Pathways to Wellbeing designation is determined. Providers can utilize the contact number 858-514-6995, which is listed at the top of the behavioral health assessment, to obtain the name and number of the current Child Welfare Services Protective Services Worker. If a provider does not have access to CCBH at the time of completion, the provider may complete a paper form but must complete the electronic version in Ccbh as soon as possible. The Eligibility for Pathways to Wellbeing and Enhanced Services form and the accompanying explanation sheet, which provides a thorough explanation of how to complete the form, are located on the RISE Pathways to Wellbeing webpage. The URL is displayed on the screen. An example of reassessment is when a youth is determined to be eligible for enhanced services subclass based upon having been recently psychiatrically hospitalized. If the youth progresses in treatment beyond the 90 days of previous hospitalization and is no longer being considered at risk for psychiatric hospitalization, the youth's status will change from subclass to class if the case remains open to child welfare services. If the answers in Section A to questions 1, 2, and 3 are yes, and either 4 or 5 are yes, the youth is eligible for Enhanced Services subclass. If the answers in Section A to questions 1 and 2, or 1, 2, and 3 are yes, but 4 and 5 are no, the youth is eligible for Pathways to Wellbeing class. When there is another BHS program involved, it is important to view the form from the perspective of your own program. Enter the active and inactive dates associated with your own Pathways to Wellbeing program designation. Providers will complete the Eligibility for Pathways to Wellbeing and Enhanced Services form for all youth that have an open child welfare services case, including voluntary cases. In this course, you learned what the Eligibility for Pathways to Wellbeing and Enhanced Services form is and how it's used, the time frames for when you need to complete the form, how to access the form in Ccbh, how to complete the Eligibility for Pathways to Wellbeing and Enhanced Services form, and some helpful tips to support you in completing the form and determining a youth's eligibility for Enhanced Services subclass or Pathways class. We encourage you to review the other courses in this learning series. Thank you for attending this course.